Hi, I'm Dr. Elizabeth Coyne and I'm going to discuss Assessment 2 for 7202. This assessment is worth 30%. I can get my slides to change. So in this assessment, you're looking at a recorded analysis that you present. So it's an environmental analysis of your practice area. So looking at a particular aspect of practice that can be good or bad, but it needs some sort of aspect of change. Use an evaluation framework to look at this practice area, and then you present your recommendations. So overall, I've given some timing. These don't need to be followed exactly, but it does enable you to sort of step out your presentation. So the first part is to introduce your topic area and your practice area. So you might talk about that this is a 30-bed surgical ward with a problem of development of pressure area ulcers on elderly population that is your main patient area in this area. And so you might then use a framework for your analysis and identify why this was suitable. So if you're using a clinical framework, you may, in this particular case, use a framework of the Lewins, where you're looking at a particular problem of lack of time to do pressure area care with this population. You may then sort of look at the change of behaviours and then how you can actually sustain that change practice. So you present your summary of your analysis, including the legal, social and ethical influences. So if we were talking about, our population being elderly, we may have the fact that they didn't have family visiting and this was an influencing factor on their lack of ability to get out of bed. We might talk about the legal aspects in relation to patient getting hospital-acquired concerns, and then the ethical issues where nurses are unable to provide good quality care to patients. We might then, the next aspect is to present your recommendations. And so you may look at sort of staffing issues. You may also look at, maybe there's a need for better beds for these patients, or maybe some different staffing mix to enable patients to sit out of bed. And so as you're going through this, you look at your current practice, what is best practice and recommendations. So you really get a sort of an idea of that this could be something that could be changed, because that then becomes A3, your change management plan. And so when you're really sort of breaking this down, introduce, discuss, present your summary and then provide recommendations. So different frameworks, these are all within the course as well. So have a look at the different frameworks and work one that works for you. So if you're, looking at a clinical one, is it, a Lewins? Is it a plan, do, act, where you can really nicely simply put it out? Are you looking at family-centered? Maybe if you're wanting to looking at educational or a family involvement, or maybe a really clinical one, which you may then use the evidence-based practice framework. Remembering that there's two ways to do this. You could record to your PowerPoint and submit that, or you could record while you're doing the slides using the just your normal computer to record. And so we will be having some exemplars in the assessment folder. Thank you.